me switch it. Oh, I have a little rat tail. Green. Oh, Dwight. What's up? Zabadula.
Okay, you tell me when you're ready.
We got one person on here, so we can wait a second. Julie's ticked off.
I am ticked off.
Things aren't just grinding her gears today. She is angry. All right, we are live.
Is this something we can also save too?
Yep, and put on YouTube.
Yes.
This will be on our YouTube. Don't back down.
Okay, so I want to give everybody an update on this patient. It's me. It's me. I'm the patient. Here's my stupid 4-prong cane. Here's my knee brace. I went to see an orthopedic surgeon this morning, and because I have severe piriformis pain right here, and I think I have a torn meniscus. Okay, so I got 2 issues right now.
Michelle said, "My day is made." I love when Julie is ticked off.
Oh yes.
That makes one of us.
I can get on this cane like a broomstick and ride it around, and don't think I won't. Okay, so this is my shitty insurance through my employer, the Arthritis Center, Anthem. We're all familiar with it. This is my insurance card. I am 58 years old, all right? This is my insurance card. I've had the same insurance for the past 9 years, okay? So I went to go see the orthopedic surgeon this morning, and he examined me, and he ordered 3 MRIs. He wants an MRI of my left hip, he wants an MRI of my lumbar spine, and he wants an MRI of my left knee. I don't think I need the MRI of my lumbar spine. I had a surgery, a disc microdiscectomy on L5-S1 in 2021. I do not need another look there, and I don't need a surgery. But I do need an MRI of my hip, which is really, really, really sore, and my knee, okay? So I called the scheduling department after I saw the orthopedic surgeon to see when I could get my MRI scheduled. And the people at VJC, who was at the office where I went to, they said, well, it's gonna take us 8 to 10 days to prior authorize your MRIs at Anthem. Okay, what? Wait a minute. 8 to 10 days? And I'm like, I was at lunch in our kitchen here in Bridgeton, and I was sitting with Dr. Bach and 2 Archie nurse practitioners. I'm like, you know what? This is bullshit. I'm gonna do my own prior authorization because I'm the patient, and I also work at a doctor's office. So Dr. Bach wrote me an order. He only thought I needed 2 MRIs, so we're just gonna take it down a notch. So he wrote me an order for 2 MRIs. Here it is right here, okay? I had to scratch out one of the MRIs of the knee because my stupid insurance, Anthem of Missouri, they decided that I can't have 3 MRIs, that I can't have 2 MRIs, that I can only have 1 MRI. Okay, so what happened was that I started the prior authorization, okay, and I talked to 10 different people. Tina, offshore, India. Lers, L-E-R-S, their spelling, not mine, offshore India. Carrie, or Connie, K-A-N-I, offshore agent, India. And after I went through the whole thing of Dr. Bach's NPI, my Anthem stupid member ID number, screw you. I'm a member of nothing, okay? I don't want to be a member at Anthem. I don't want to be a member of anything. I'm a patient. I want someone to treat me with respect. And when I have a problem, by God, I want to get something. You think this is fun, Anthem, for me to be on some 4-prong cane with my mother's name on it, my 83-year-old's mother's name on it? It's not. And I don't just want MRIs for the hell of it. I'm freaking hurt. I want some help. All right, I talked to Sherelle. Spent 25 minutes on hold with Sherelle. She's an agent in California. Talked to Laura. Laura said, Sherelle transferred me to Laura, and Laura said, oh my God, this is the wrong department. You need to call Carillon. Okay, Carillon is careless. You heard that right here. Carelon cares less. All right, so then I called them, 833-305-1807. If anybody is looking for a good time, do not call Carelon.
Patient abandonment.
That's their phone number. So I called them, and I talked to one agent. You know, every time I do this, this is like 20 minutes of BS. All right, press 1, press 2, NPI, tax ID, EIEIO. Then I talked to Joan. Also, now I'm back offshore again. My favorite freaking place. So then Joan's like, I went through all the clinicals with her. This is a freaking joke. I am a physician's office in Missouri, in the United States of America, on the phone with someone who claims her name is Joan, but it's probably like Lampunjabe, which is fine, but that's not her real name. I'm going over my clinical information with her, and she, get up here, Bunny, climb. And she goes through all of the clinicals with me. I have to say, let her read an entire list of 4 things of tried and fails and blah, 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 and diagnosis codes and blah, 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 all that. And she goes, it's denied. I'm like, no. It is not denied. I said, Joan, you got to be kidding with me. I have spent now close to 2 hours on the phone with all these different agents at frickin' Anthem with goats in the background and going nuts, and now all of this, you deny it?
We have CVS on line 1 regarding a PA that we said we're not doing.
Oh, perfect. Let's just flip to this call. Go ahead and let's just listen to this, Claudia.
This is Claudia.
Here, get over here. This is part of our prior auth. We're not gonna prior auth stupid shit anymore. That's cash. Whoops. Do you want to do it at your desk and I'll keep on with this?
So, just have her pay cash for it, or we can even send it to Cost Plus RX to where she can get a better price. But Good RX, I attached the coupon on there.
CVS is on the phone for Claudia because we're not prior authorizing stupid, inexpensive medicines anymore, and they're all bent out of shape because they want.
You're her
Specialty pharmacy.
You're her specialty pharmacy, right? Oh, sorry, that was just to the other CVS.
CVS. Yuck. Oh shit, my little finger went down. So Claudia's having a little dust up at CVS because we're not.
We sent it to both. But so I would just recommend the patient paying cash price.
Yeah, you would.
All right, thank you. Have a good one. What was your name?
Lampunjabe.
She hung up on me.
Of course they did. Forget CVS. All right, let's go back to this mess. So then I talked to Joan. So Joan denies
Julie
it.
for president.
Oh please. I'm on a freaking 4-prong cane. What I'd like to really do is I'd like to run HHS or CMS, and the first damn thing I do is shut down the PBMs. So
just sign yourself up for a Carelon portal for your office and submit online. You can do all 3 orders.
Yeah, well, guess what? I don't have 8 to 10 days. I want to get this done sooner. All right, and I have all that stuff, but they want to fax clinicals and all this other nonsense. Okay, so Joan denies it. So I have a meltdown on the phone with Joan, and I said I demand to speak with the physician reviewer. So some time goes by, and then I get Donna, who's an RN, and I'm like, listen, Donna. At least she was in the States. And I said, this is crap. I need a physician reviewer to talk to Dr. Bach about his patient. I've been on the phone for 2 hours and 30 minutes. Donna was the 9th person I talked to. So she's like, yeah, hold on. So then all of a sudden, a physician reviewer, or at least someone who identifies himself as a physician, not sure what country they are in, but they got on the phone and they're like, I don't know, they probably spent about 12 minutes on the phone with Dr. Bach. We were live on TikTok. And Dr. Bach went over the whole thing, and he's like super nice about everything. Not me. I'm salty as can be because I am trying to speak for the patient, which happens to be me, all right? And I've freaking had it. I've been suffering with this too long, and I'm tired of messing around. So after all of the nonsense back and forth, the physician reviewer says, we will approve 1 MRI of the 2 that he wrote the order for, okay? So Dr. Bach's like, okay, forget the knee one because her hip is more acute. We'll take the hip one. So here's my authorization number. You ready? Here's my authorization, 235864526 from today. That's good for a whole month. Oh, thanks a lot, Anthem and Caroline. You guys are so great.
How much did you save?
But hold on. Wait, there's more. You ready for this thing?
As
I
she
call
waffles.
up the MRI place that I'm going to go to, which is a non-hospital one. And I call them and I get this scheduled. I'm going to be getting an MRI at 9 a.m. tomorrow. I don't know if Claudia's coming with me. We could go live and see how that all goes, but probably not because they're not going to let her back. But the MRI place calls me back and they said, oh yeah, there's some patient responsibility with your authorization number, okay? I owe $393 for my patient responsibility. Okay, seems kind of steep, but whatever. I said, how much is it if I would have just paid cash and not done all the rigmarole with Anthem? You ready? It would have been $400. I saved $7 frickin', okay? I'm so over insurance. Insurance is not insurance. It is an expensive waste of time coupon. Like, I have not had any issues up until this year, up until my 58th year of life. And now I've got some issues and I say I'm going to save $7 frickin' on this MRI with Anthem's amazing frickin' negotiation and all the BS. So this makes me even more fired up than ever to start dumping insurance companies around here and start doing direct care. Last year we dumped Cigna because of their administrative burdens. We left them on August of 2023. This year we're dumping HealthLink because get this, HealthLink, they want the physicians doing the work to pay them a 5% fee of billed charges. Do you know how insane that is? Do you know it was costing me $1,000 a month for the privilege of serving HealthLink patients? By Felicia. I am incensed with the horrid situation that we're calling healthcare. And y'all are going to go on this little journey with me to fix my hip.
Michelle is starting a direct care practice in Virginia this year.
Beautiful.
Have you heard of the FMMA? You should check it out if you haven't. Julie started the Missouri
The
FMMA.
Missouri chapter of FMMA. We just got to get our shit together and stop doing all these prior authorizations for my hip and be able to spend that time caring for patients and doing work on FMMA because I have had it. I've been serving patients and doing what I do, and I did it for myself today, and it absolutely blows that for 2.5 hours of my time, I saved $7 frickin'. I can't even get a hamburger and a Coke for
I was
that.
gonna say you can't even buy us lunch tomorrow.
No, this is craziness. So I'm super fired up about this. So let's review. If your insurance card looks like this, it's garbage.
Well, and how much do you pay each month?
I pay $1,800 because I'm 58 years old and you pay based on how old you are. This is garbage. I'm paying almost $2,000 a month and now I get to pay again and again and again and again. This is garbage. Garbage. We got to change this, folks. We have to change it.
Well, and what are your recommendations on changing it?
Well, it's free market medical, and we just have to get insurance not tied to employment anymore, and we need to be able to actually get something for our premiums. I'm getting premiums, and all I'm getting is a bunch of freaking headaches and runaround and bullshit from Anthem in all these other countries, and then to have an Anthem, the 10 people that work for Anthem. Do you understand? We are paying their salaries to screw with us, to deny care. That's what my $1,900 a month is going to, is 10 people in India to deny my freaking care.
Agree. Healthcare should be universal right for the people in this country, not a privilege.
It's terrible.
You can get a pub cup from Starbucks maybe.
For 7 large? Okay. All right. I'll allow it.
But, we work in the health. For Julie to get it denied is...
I know what I'm doing. I know what I'm freaking doing.
And it's kind of
And I still
disheartening
got
for
it-
our patients.
And still got it denied. And part of it could be the language barrier between me and Lampoon Jabe, who denied it because her English is not the first language, and I have difficulty hearing her, and I don't know what box she marked. I don't know if she's using a crayon or a sharp pencil. Like, this is all algorithm denials. That lady didn't deny it. The algorithm denied me. The algorithm is directing my freaking healthcare. And if I wasn't such a big bitch, I would have let it go. But I am, and I'm hurting. My freaking hip hurts. Something's wrong with me, and I need care. And I've been paying into this shit system for 9 years to Anthem. Haven't used any of it.
Well-
Even when I had my surgery in 2021, I still had to pay my deductible, and the surgery was $2,900. And guess what? Guess how much my deductible was? You got it, $3,000. So
With what you're paying now, you might as well just put it into a net for if something like this happens, and then you have a catastrophic bank of like 14 months. You'll have a $14,000 just in case net.
well, $14,000 isn't going very far if I get hit by a bus, but I might hit myself with a bus based on that. All right, that is all. I'm gonna go back to work, but I am pissed off. This sucks, and I actually know what I'm doing, and they're still denying my care. So stay tuned. We had to take a little hiatus because I was out of town on Friday. She
I was
got
sick.
sick. We're back, and I'm mad as hell.
The only thing I hate more than commercial insurance is managed Medicare.
Oh my God, managed Medicare, Medicare Disadvantage. I mean, it's all shit. It's all garbage. It's all garbage, and we have all of these people that we're paying their salaries to deny our care. Like, this is nuts. How we got here, I don't even give a shit anymore. We just need to completely blow the system up and start over.
No way, Medicaid is worse.
Okay, it might be. It might be. All right.
Y'all need merch.
Fiddlesticks.
We'll get some merch going with
Oh
our
my
work,
God.
with our sayings.
How about we put out canes with my mother's name on it?
She's the fact it has her mom's name on it really keep fighting, says Carol Wright. Out of state Medicaid is definitely the worst. Agreed. Michelle Hayes, we need to connect. Email Claudia@drbach.com.
Do you need to spell Dr. Bach?
DRBAAK.com.
As we act our way into
This is
fun.
just
This is just
And I'm-
acting and fun.
This is an informative, educational piece. It's based on real life events. Some maybe.
Some of the names have been changed, except for mine.
I've been
okay?
watching Law and Order, so I was trying to think of what they do. Some events have been heightened.
You know what? People that don't have anything to hide nothing. This is how convinced I am that the system sucks. That I'm willing to show my order, my stupid insurance card. I don't care. I am gonna go down with a huge freaking fight on this thing. We're gonna figure out what's going on with my hip and get rid of this stupid, ugly cane with my mother's name on it.
I need to get a sticker so
I
we can
need to
take
get
a
back to
name off.
doing the things I want to do, like playing tennis and stamping out disease and saving lives.
AAKDOWN. Have a good day, guys.